Great, thank you, Mai. And frankly, I think you said everything I was going to say, so we can just stop right here. Um, so as as Mai said, my name is Pietro Michelucci. I lead the Human Computation Institute, where we develop and build crowd-powered systems to tackle societal problems. So for example, we created an online game called Stall Catchers that now has 30,000 players, speeding up Cornell University's Alzheimer's research. So when COVID-19 emerged, we started to brainstorm about whether we could somehow apply these same methods to reducing the impacts of the pandemic. And we came up with an exciting idea. So we were thinking, where do people go when they're social distancing? Where do they still have to go? So to the store, to run errands. So we had this idea that when lots of people all go to the same store, the infection risk is higher. And if we could evenly spread people out across stores, maybe we could reduce virus transmission. So we did some napkin math to see if the numbers work out. So if you take 9 people, put them all in the same store, each person is exposed to 8 other people, each of whom could already be infected with COVID. So that's 72 different ways that infection could spread. But what if you had 3 stores and you could distribute those same 9 people so that there were only 3 people at each store? Then each person would be exposed to only 2 other people, which adds up to 6 ways infection could spread in each store, or 18 total infection opportunities. So spreading people out evenly resulted in 4 times fewer infection opportunities. The napkin math confirmed our intuition, but the next question was, how do we get people to actually do that? And we realized that given the option, some people might drive a little farther to reduce their infection risk by going to a less crowded store. And the easiest way to provide that information might be a navigation app like Google Maps, where people could see infection risk color-coded directly on the map as green, yellow, or red to indicate the crowdedness of each store. So by this time, we had this tantalizing idea and a possible way to make it work. But we were also mindful of the Hippocratic oath, first do no harm, because we know from experience that even with the best of intentions, things don't always work out the way we expect them to. There can be unintended side effects and feedback loops, and these things only show up when a system is deployed into the real world. So before unleashing CrowdMeter, we want to understand if there are circumstances in which it'll cause more harm than good, or in what situations it could be most effective, and then use those findings to inform our specific design to ensure CrowdMeter is built and used in only beneficial ways. So for example, if only a fraction of people are using the app, it could really help them. But if everyone uses the app, it could potentially backfire. So if they all rush to the safest store, then it suddenly becomes the most dangerous store and everyone there gets infected. And to make things even trickier, this situation could arise due to a media feedback loop. So if the media reports on rising infection rates, then we could suddenly see an increase in CrowdMeter adoption, possibly creating this kind of overload situation. So how do we figure out how to do no harm without putting people at risk in the process? So as a start, we run simulations, which are basically computerized mock-ups of the real world that capture the important parts of what we want to understand. There are many COVID simulators already out there, but our simulations are more complex and have unique requirements because we're trying to understand what happens when you introduce an online app that impacts how many of these different systems interact with each other. So we have a model of human decision-making behavior that balances risk aversion against the burden of traveling farther, a model of the virus, a model of disease spread, population flow model of human movements, and a model of how CrowdMeter would work. But simulations are only as good as their underlying assumptions, garbage in, garbage out. So we gathered a team of specialists to help ensure that these 5 interacting models approximate real-world conditions. With kind support from Aspen Tech Policy Hub and a donation of Azure Cloud Computing time from Microsoft, we built a CrowdMeter simulator to help us test and refine the CrowdMeter concept before we go live. And this is what the simulator looks like. So this grid represents a hypothetical town. And then the 3 big dots are grocery stores, where the color of the store tells how crowded it is. And the tiny dots are people. So green people represent healthy and red people are infected. And then any dot with a little black outline around it is a simulated person that's using the CrowdMeter app. Since our main goal is to flatten the curve, the first question we ask the simulator is whether or not CrowdMeter can actually do that. So flattening the curve doesn't necessarily mean reducing the overall number of people who eventually get infected by COVID. It means to slow down the infection rate so that our healthcare system does not get overloaded and people who get COVID can actually have better outcomes. And until we have a vaccine, this is our best option. And even with vaccines, it can still help. So we ran our simulator with a range of CrowdMeter adoption levels. And the first thing we noticed is that with more people using CrowdMeter, we were actually seeing a more even distribution of people going to different stores, which is exactly what we'd hoped for. Next, we looked to see if the curve got flatter when people were more evenly spread out over stores. And we were quite surprised to discover that it didn't. But we soon realized that our initial assumption of 10,000 people sharing only 3 grocery stores in our simulated town resulted in a very high person density at all 3 stores all the time. This meant that even when people went to the safest store, they were almost certain to become infected. So in that circumstance, using CrowdMeter to distribute people evenly across stores gave no advantages. But when we adjusted the population size in our simulator to real world values, about 1,000 people per grocery store, we saw exactly the kind of curve flattening we expected. So CrowdMeter was working. And so then the next question was, if it can work, is there such a thing as too much CrowdMeter? So we ran more simulations at very high adoption rates. And we discovered that infection rates do start to go back up, which made us realize there could be such a thing as a CrowdMeter overdose, where adoption levels could get so high that we start to see an opposite, or what they call a paradoxical effect. So we thought the reason this happens is due to the travel delay between when people decide to go to a store and when they finally arrive, by which time the store could be more crowded. So this made us wonder how data latency, which is the freshness of the CrowdMeter information, can impact how well CrowdMeter works. And this is important because the population flow data sources available to us for the CrowdMeter app are not perfectly real time. There are some delays. So we decided to test this explicitly again by looking at different levels of data freshness to see if CrowdMeter could still be helpful even if the data were not perfectly real time, but instead near real time. For example, what happens if the CrowdMeter data is 15 minutes old or 30 minutes old? How does that impact the flattening of the curve? And we discovered that with moderate data delays, CrowdMeter could still be helpful. But beyond about 40 minutes of delay, it could actually increase infection rates. So observing in our simulations that the combination of high adoption levels and data delays could actually make things worse, we set out to examine the full space of those conditions to get a better sense of where CrowdMeter would likely be helpful or harmful. And this set of simulations revealed a safety zone, depicted in green here, and a danger zone in red for operating CrowdMeter. Now, all the simulations so far were based on COVID-19, but we hope that CrowdMeter could be used in the future to help attenuate the spread of other viruses, such as influenza. But each kind of virus has its own characteristics. So we set out to also simulate the impacts of CrowdMeter on viruses with different levels of infectivity, and discovered that for COVID and influenza, it could be most effective, and possibly for the common cold. But for highly infectious diseases like the measles, even CrowdMeter can't contain the spread, and situations like that will require strict quarantines. So what do all these findings mean? Well, we learned that under certain extreme conditions, CrowdMeter would not help at all. For example, when there were too many people in all the grocery stores, when there was an unusually high ratio of people to grocery stores, which could happen, if half the grocers shut down suddenly, or when the virus is highly infectious, such as with the measles. But the good news we discovered is that for the current virus, COVID-19, and the typical conditions found in most places, CrowdMeter will flatten the curve. We also learned that CrowdMeter, like any intervention, has a therapeutic range. For example, antidepressants can actually worsen depression at the wrong dose. So similarly, if we think of CrowdMeter like an anti-pandemic pill, we've observed a similar paradoxical effect where increased adoption is beneficial up to a certain point, after which it can actually cause harm when data delays are present. So what's next? So that green area in the final graph represents CrowdMeter's therapeutic range. And so our next step is to release a pilot version of this app in a context that falls within the safe green area of that graph with with participants who voluntarily and knowingly agree to contact tracing, so we can test our assumptions and simulation outcomes against a real world implementation. And then we'll use those results to fine tune CrowdMeter before releasing it into the wild. We also intend to run new simulations to test if CrowdMeter could be even more effective by evenly distributing store visits, not only between stores, but also at the same store over different times of the day, and then use artificial intelligence to predict population flow to make that work even better. We're encouraged by these results, and with CrowdMeter safely deployed, maybe we can more easily create a new normal that we can all live with. Thanks.